Hello, everyone. Thank you for joining us today for our webinar on a guide to roster management and patient recalls for family physicians in the FO model. Let me start by introducing myself. My name is Maral Sanassian, and I'm the Director of Client Success here at Doctorcare. Doctorcare is the largest provider of billing and practice support for over 2,500 physicians across Canada. On average, we have helped doctors recover $25,000 to $30,000 of revenue per year. We also support approximately 25% of all FOs in Ontario. Our solutions and our services are designed to help you, doctors, ensure that they are maximizing their revenue, improving patient care, and growing their practice. Just so you know, all attendees today are in listen-only mode. We are recording this webinar, so it will be available to you after this event. If you have any questions during the webinar, please submit your question in the Q&A feature. Know that your questions and your identity will be kept confidential and only be seen by our team. We will do a Q&A session to answer some of your questions at the end of this webinar today. Whether you've just joined a FO group or have been in one for a long time, we understand the challenges you face day in and day out with managing your patient roster effectively while striving to provide optimal care. Today, our webinar will be divided into 3 parts. We will first provide an overview of the FO model. Then we will discuss the best practices for patient roster management. And then in part 3, we will look at effective patient communication strategies, which can improve your ability to deliver diabetic and preventive care, handle after-hours care, manage your outside use, and leverage billing advantages only available for your rostered patients. Let's start with a brief overview of the major income streams for those physicians who have just joined their FO. There are 6 major income streams in a FO model. First, we have capitation payments. These are payments that you receive annually for your rostered patients. Fee-for-service billing. These are any out-of-basket codes that you are billing on rostered patients or any visits on non-rostered patients. Access bonus. This is a bonus that you receive monthly for managing your outside use. Shadow billing, which is about 19% of the in-basket services that you are providing to your rostered patients. Preventive care bonus, a bonus that you receive annually for providing preventive care for your patients. This includes influenza vaccinations, pap smears, mammograms, childhood immunizations, and colorectal cancer screening. And lastly, your special premiums, which are premiums you receive for providing services under hospital services, labor and delivery, palliative care, and so on. Today, our primary focus will be on your capitation and access bonus, and we will illustrate how these are connected to your rostered patients. Let's start off with capitation payments. As mentioned in the previous slide, capitation payments are payments that you receive for your rostered patients. As you can see on the chart on the right side, capitation for FO physicians is comprised of 2 components, the base rate payment and the comprehensive care payment. Both are calculated based on the age and sex of each rostered patient. On average, FO physicians are getting approximately 200 doctors per rostered patient each year. Here's a nice chart illustrating your patient's age and the associated capitation value. On the left-hand side, you can see the income per patient per year. At the bottom of the chart, the ages are indicated. For females, the income starts off just under $200 per year per patient. Then it drops down and then peaks up again around ages 14 to 15. For males, the income starts off just over $200 and then peaks again around the ages of 30 to 35. Now that we've covered how capitation works, let's talk about how to manage your roster effectively. The Ministry of Health requires that every patient be enrolled to a family physician, as being rostered results in a better doctor-patient relationship. As you may know, the number of patients rostered according to the ministry may be less than the number of patients you have rostered according to your EMR. This can occur due to several reasons, including patients accidentally rostering at walk-in clinics, the roster code, the Q200, being rejected or never submitted, patients falling off your roster without you knowing. It is very important to identify the discrepancy between patients rostered according to the ministry against the patients you believe to be on your roster to ensure that you are providing the best patient care and are getting paid for the care that you provide. So what are the best practices for roster management? First and foremost, to effectively manage your roster, you need to be continuously reviewing your roster lists and making sure that the patients you believe to be on your roster are in fact enrolled to you with the ministry. Additionally, ensuring your roster is of proper size and composition is helpful in building a roster that meets your personal goals. In essence, effective roster management is extremely important in the phone model to not only meet the needs of your patients, but also your individual needs as well. We have a lot of doctors asking us, what is the optimal roster size? On average, we have seen doctors have about 12 to 1,300 patients on their roster. In terms of the maximum size, based on the latest updates from the Physician Services Agreement, the ministry suggests that the average faux roster size should be no greater than 2,400 patients on average per physician. Ensuring that the patients that you provide comprehensive care for are on your roster will allow you to not only bill for the codes available to rostered patients, but will also help you maximize your revenue through capitation. So how do you roster patients? To roster a patient, you must submit the Q200 code. There are also a few rostering incentive codes: the Q023, which is the unattached patient fee, the Q043, which is the new patient FOBT positive fee, and the Q053, which is the complex vulnerable patient fee. If you do have a patient that falls into these categories, it's good to be aware that you want to be billing these incentive codes with the Q200 to get the premium payment. Rostered patients have a few benefits to faux physicians, such as being able to submit certain billing codes, triggering bonuses, and attributing towards a preventive care bonus. In addition, you can bill more codes over the phone if the patient is rostered to you. Here are a few examples of the premium fee codes available exclusively to rostered patients. If you would like to learn more about these codes and their billing requirements, we will share all the relevant resources at the end of this webinar. Moving on to the financial impact of a roster increase or reconciliation. How much are you actually going to make? Now, as you can see in the chart, if you rostered an additional 100 patients, you will be making, on average, $200 per patient per year, which results in $20,000 more a year. To further show you the impact that effective roster management can have on increasing your revenue, let's go through a case study of a physician that we have helped recently. A doctor signed up with us with a roster size of 1,300. We did an analysis and identified 250 patients who were not rostered to this physician. We sent out rostering forms to the patients, and within the first 2 weeks, we received 60 of those roster forms back. Now that's about $12,000 increase in revenue that the physician received from that one round of forms that we sent out. After that, we sent out another round of forms and again received another 20 forms. which now adds an additional $4,000 in revenue captured. In total, the physician rostered 80 patients within 1 month and received about $16,000 in revenue for those rostered patients. This is not a unique case study. We conducted a number of comprehensive roster analysis reports over the years and have discovered that many doctors have hundreds of unattached patients that need to be rostered. With our newly added services, we can take the extra step and roster your patients for you. In addition to identifying which patients are currently on your roster and any discrepancies of patients seen in the last few years, we will provide patient education and enrollment forms, as well as roster the patient by billing the Q200 code on your behalf. We'll go into more detail about this new offering later in the webinar. However, if you have any questions about how we can help you manage your roster, please feel free to email us after the webinar at info@doctorcare.ca. Now, moving on to part 3 of the webinar, where we will discuss best practices for patient recalls in areas such as diabetes management and outside use. Proactive patient communication methods are key to the continuity and the quality of care for your patients. By reminding patients about upcoming appointments, screenings, or follow-ups, you ensure that patients receive timely and appropriate care, reducing the risk of missed opportunities for diagnosis, treatment, or preventive interventions. In addition, timely patient reminders can go a long way in maximizing your income. This specifically applies to diabetes management, outside use management, and other ad hoc patient communications. We will explain each of these categories in the next few slides and show you how Doctorcare can help you stay on top of your patient recalls. Having a recall system in place helps improve the quality of diabetes care, as it is a reminder for clinicians to recall patients for tests and appointments. The ministry recommends that the physicians set up a process to see their diabetic patients quarterly and ensure that nothing falls through the cracks. Here are some of our recommendations to stay on top of your roster. Book the patient's next appointment before they leave your office. If you are unable to book the next appointment with your patient, train your staff to actively call and reach out to your diabetic patients for their next appointment. 3, manage your list of diabetic patients. We recommend keeping track of your patients and when they were last seen. By proactively recalling your diabetic patients and sending them timely reminders about their upcoming checkups, you will be able to bill the relevant codes at the right time. This approach increases your potential earnings on a standard-sized roster of diabetic patients. If effectively managed, diabetes management can yield approximately $216 per diabetic patient. Now let's take a look at another case study. If you have a roster size of 1,300 patients and assume that about 10.5% of your patients require diabetic management, which is the percentage based on Statistics Canada, that would be about 136 patients. With 136 patients at $216 per patient, you would be making an additional $30,000 a year for seeing those patients. In addition to patient recalls, we also want to mention that to claim your $216 per patient, you would need to accurately bill your codes. The 3 main fee codes that physicians bill for their diabetic patients are the K030, the Q040, and the K029. Now, these codes are all out of basket, meaning that physicians are paid 100% of the value for these codes. The Diabetes Management Assessment Code, which is your K030, is an all-inclusive service payable to the most responsible physician for continuing and managing and supporting diabetic patients. The code is valued at $40.55 and is billable up to 4 times a year. The code requires a completion of the diabetic flow sheet, which you can download after this webinar. The Diabetes Management Incentive Fee Code, which is the Q040, is payable to physicians who provide ongoing management using a planned care approach consistent with Diabetes Canada's guidelines. The code is valued at $60 and is billable on an annual basis. And lastly, the Insulin Therapy Support Fee Code, the K029, is payable to physicians who provide support and counseling on intensive insulin therapy requiring at least 3 injections per day or using an infusion pump, or training on insulin for patients who use glucose meters, insulin pumps, or insulin pens. The fee code is valued at $67.75 and is limited to a maximum of 6 per patient per 12-month period. If you have any questions on the billing requirements and the best practices, please feel free to contact us after this webinar. Based on what we've covered for diabetes management, you can see that it takes a lot of time to ensure that patients are being recalled for these visits. This is where we can come in and help you. In addition to roster management, Doctorcare can also help with managing your diabetic patient recalls. With our new service, we will look into your EMR to identify patients who have not been seen in over 3 months, conduct monthly diabetic recalls, and help you set up the process for recalling patients on your online booking system if you have one. Again, feel free to email us after the webinar to learn more about how we can help you. Now, let's switch gears to talk about access bonus in outside use. What is access bonus? Access bonus is a bonus that physicians receive based on the number of patients that they have rostered. It is important to clarify that when patients go to walk-in clinics, physicians do not lose their regular income, but rather miss out on a bonus potential. What is outside use? Outside use occurs when a patient rostered to you visits a physician outside of your FO group for comprehensive care. For example, if your patient goes to visit a walk-in clinic for a cough or a cold, that is considered outside use, and your access bonus will be deducted. Over the past few months, we have seen some of our FO doctors receive letters from the ministry about service obligations relating to negative outside use results, as well as other poor performance metrics, such as insufficient number of patients seen per week. The ministry measures the FO performance against current FO averages and top performers in areas such as the number of patients seen per week per physician, group collaboration, so the percentage of visits to an enrolling group but not an enrolling physician, and after-hour requirements. We know it's hard to control patient behavior and know that patients are unaware of the impact of seeking care outside of your FO. Although optimizing your availability and scheduling plays a big role in managing your outside use, one of the main reasons that often goes overlooked is the patient education piece. Many physicians experience high outside use from their patients because their patients are simply unaware of the impact outside use has, not only on their continuity of care, but on their physicians as well. Here are some best practices you can implement to educate your patients about the continuity of care and what it means to be in a FO group. Provide direct communication. Physicians can take the opportunity during an appointment to explain to the patient the impact of outside use. Provide patient education materials Physicians can distribute pamphlets and brochures in the office or some online resources. Set up visual reminders. Physicians can set up posters in their clinics, in the waiting room, or their individual offices. We have an outside use poster template that we've shared with doctors to put up in their offices. Send out communication pieces. Physicians can share information through email or even direct mail. Having various touch points with patients is important in enhancing awareness around outside use and reducing future instances. These are the key best practices around patient communication. If you are interested in more information and strategies to manage outside use, we have an on-demand webinar, flow optimization and outside use management strategies, or a quick reference guide, outside use, that we can share after this webinar. As you can see, patient communication can take up a lot of your time to set up and ensure patients are receiving the right information. At Doctorcare, as part of our new offering, we help you with educating your patients about outside use. We can help set up a mass communication piece to reach all of your patients and let them know of the impact of outside use. If you have any questions, please feel free to contact us after this webinar and we can help. Patient communication is important in ensuring that your patients are aware of the latest changes happening at your clinic. We recommend that physicians set up processes to send out mass communication to their patients. These communication pieces may include introduction to new services, changes in your opening hours, various operational announcements such as new schedule changes or location changes, patient recall reminders for preventive screening or diabetic calls, outside use education, advising your patients not to use walk-ins and providing them with their after-hours schedule, doctors joining or moving clinics, and so on. Again, with our new offering, Doctorcare can help ease the burden by handling all such patient communications on your behalf. Depending on what your clinic-specific needs are, we can create a customized plan for you. Let's go through some key takeaways for today. So first off, physicians receive about $200 per patient per year in capitation. As long as they are on your roster, you will be paid each year as long as you are their primary physician. This is why it is so important to ensure that the patients being seen in the FO are actually on your roster. When it comes to diabetic recalls, it is important to be proactive. It means reaching out to diabetic patients and sending them timely reminders about their upcoming checkups. This way, you can bill the appropriate codes at the right time and maximize your revenue. Patient education around outside use is often overlooked, but definitely an important piece in reducing future outside use. Proactive patient communication does equal continuity of care. Patient communication includes various screening reminders, clinic announcements, and other outgoing communication. And most importantly, we are here to help. We have an exciting new offering that can help you with all these key takeaways that we will share on the next slide. We would now like to fully introduce our latest offering, Patient Care. The Patient Care service is designed to reduce your workload and assist you with all aspects of roster management and patient recalls to make sure you can maximize your revenue potential with minimal effort required on your part. With our new service, we can help physicians enhance their patient care and operational efficiencies and generate revenue upwards of $25,000 a year. We provide end-to-end roster reconciliation, which includes identifying patients who are not rostered to the physician, sending out rostering forms, collecting forms and billing the rostering code, On the patient recalls and management side, we help with monthly diabetic recalls, identifying diabetic patients that have not been seen in over 3 months, recalling patients on your online booking system. And as mentioned previously, we also support physicians with any mass communication you may have. The plan can be customized and based on your needs. We can integrate with EMRs and integrate with patient communication software, such as Ocean. To thank you all for attending today, we are offering an exclusive promotion to all of our webinar attendees. Until July 14th, we are offering a 25% discount on our patient care monthly subscription. We highly encourage all doctors who are interested in taking roster management, patient recalls, and communication off their plates to take advantage of this new opportunity. Please do contact us today at info@doctorcare.ca if you're interested in getting started. Now, let's move on to some questions from the attendees. If you have a question that you would like to ask, please submit the question in the Q&A feature in the Zoom console. Your questions and your identity will only be seen by our team, and I will read out your questions, but will keep your identities confidential. So I'm just going to give it a couple of minutes for everyone to have a chance to type out their questions, and then we'll dive right into the most commonly asked ones. I see some great questions coming in. I'll give it another couple of seconds and dive into some common themes I'm seeing here. Okay, so we have a question here. So this physician is asking, so they've got Oscar Pro, and they're asking, is the new service or the new services compatible with their EMR? So the good news is yes, our new patient care service is compatible with all EMRs, whether you're on Oscar Pro, Practice Solutions, Accuro, regardless of your EMR, patient care will be able to serve you. So then we've got a theme around messaging. So what if your EMR is not compatible with messaging? So if your EMR is not compatible with messaging, then we can do patient communications via physical letters using Canada Post. And we can have patient reminders and communications via pre-recorded messaging and phone calls. So even if your EMR is not compatible with messaging, we've got alternatives that we use in order to make sure that we can communicate with your patients via physical letters and or phone calls. We have a question here. If I already have a third-party messaging system and online booking, what happens then? So in this scenario, we would assess the functionality on a case-by-case basis. And for the most part, utilize your existing software if it's possible. So we're going to do our best to use your third-party messaging system and online booking tool. And we'll think through alternatives only if that doesn't follow through. So we've got high success there in most scenarios. Now, with regards to the service and the commitment, so patient care is a service wherein we'll be able to support you over a 12-month term. So we have found that to get the most benefit out of patient care, monthly upkeep of your roster is highly impactful. throughout the term, as patients are constantly falling off the roster and at times new patients are missed being brought on. So we do support you over a 12-month term, reviewing your roster month to month and supporting you with any additional recalls or services that you can benefit from. So with regards to patients that are not rostered, so the question is, how can I check to see how many patients I'm seeing that are not rostered? So it's tough to tell. Historically, EMRs are not the best at really telling you clearly who the patients are that are on your roster, and it doesn't automatically reconcile against the ministry's roster list. So physicians tend to have a number of patients that they are managing who are not rostered in the eyes of the ministry. This is really common. We see this very, very regularly. Doctorcare does have a method of identifying your patients that you are seeing that are not rostered to you, and therefore would be happy to run the analysis first so that you can see what the discrepancies are prior to next steps. So if you are not in the FO, so we have a question. If I'm not in a FO, however, I'm interested in joining one in the future, are you able to help me with that? So absolutely, we can certainly help. We have been managing FO groups for many, many years. And with the new physician services agreement, it's helped a lot more physicians transition into the FO model and take advantage of the number of services that we illustrated and benefits in this webinar. So we're currently still offering a complimentary transition analysis where we do an income analysis for you and show you the value of switching to a FO model. So if you are interested, please do feel free to contact us after this webinar, and we'd be happy to run that analysis for you and support you with whether it's a good decision for you or not. And so in terms of what physicians need to form their own FO, so there are 3 key requirements, I would say. So you do need to be a group of 6 at minimum now with the new PSA changes, 3 of which must be co-located at one site. And then if there are multiple sites, it is important that each site is within 5 kilometers. So those are some of the key requirements that we do see come up over and over again. Again, please reach out to us if you've got interest in learning more about that transition or how to form your own FO. We have loads of experience and we can definitely help. And then I'll take one more here. So the question is, what other messages can you send out? So we can send out almost anything. This program, patient care, is totally customizable based on your clinic's needs. And with this service, we are here to fully support you to create the messaging you need to get across to your patient base. Physicians have found other great reasons for patient messaging, like preventive care reminders, chronic disease reminders, recalls. Outside use education is a big one we spoke about. General clinic updates or announcements is one that's relevant as well. So really, it's all about what is relevant to you and your clinic, and our team will work with you to ensure that you are getting the most out of patient care. Excellent. So with that, we will come to the end of our webinar. On behalf of Doctorcare, thank you so much for joining us today. If you do have any more questions or feedback on this webinar, please do feel free to contact me at any time. My contact information is on this slide, and I do hope you have a wonderful day.